Hello everybody, good evening and welcome to the second webinar of the webinar series hosted by the College of Dentistry and Stomatology Sri Lanka together with the Faculty of Dental Sciences, University of Peradeniya. We are reaching out to you with another exclusive topic, and today's webinar is going to be woven around the most discussed topic of the year, that is COVID-19. This topic will bring some fresh perspective onto the table as to how the dental practice need to be changed and adapted to this fluctuating environment, especially at the verge of a possible second wave. And to talk more about this, we have with us an environmental engineer from University of Moratuwa, Sri Lanka, Professor Mahesh Jayavira. He's a fine product of Royal College Colombo, and he graduated from University of Moratuwa in 1991 with a first-class honors in civil engineering, and then earned his PhD in ecological engineering from Saitama University, Japan in 1995. He is well-experienced engineer in the field, and he has also undertaken many consultancies, including the projects related to Colombo and Gold Port and the Southern Highway. So with that introduction, let me invite Professor Jayavira to deliver his presentation. He will be talking to you about the environmental perspectives. So over to you, sir.
Thank you very much, Kalani, and thank you, Gishan. And let me share the presentation. Okay, good evening to all of you. I do believe that you can hear me well, right? And also, I hope that you can be able to see my, presentation. Okay.
Yes.
So my topic is, what I'm asking you is whether you are prepared to, get rid of this COVID-19 virus in particularly dental settings. How you're going to look at from the environmental point of view. So that is what I thought that I should share with you all, so that most of the burning issues that you have had at the moment will be answered at the end of this presentation. Okay, so just to start off, just want to give you a little bit on the statistics. I'm not going to go into each and every, because you know very, very clearly where we stand, let's say as of today. But look at most of these statistics says 98% of this COVID-19 patients suffer from mild condition, or in other words, we call it asymptomatic. So that is the danger that all of us are faced with today, because you don't know who the patients are. So therefore, basically in your dental setting, I would presume that we need to consider each and every patient to be a COVID-19 patient. So that is the presumption that I do believe that we have to be. Otherwise, you may not be able to solve this problem. When you look at the history of these viruses, right? So everybody knows that this is not the first time that we have found this type of pandemics. There have been quite a lot in the previous years. And when you look at the after 2000, there have been quite a lot. And if you look at this figure, you see that, just to show here from this, look at this particular range or the region, and most of them came after 2000. Most of them came after 2000. What I just want to show you here is future would be very bleak for you all, particularly for the dentist. You got to expect this type of viruses coming in, and you are the most vulnerable people in the medical sector. Why? Because you have to, just keep the mouth open all the time when you work with the patients. So therefore, you are much susceptible for contraction of these viruses. So therefore, remember, the action, whatever you take today, would be very, very important even for the future pandemics that would be very imminent near future. When you're looking at, say, for example, this type of pandemic, always what is important is we need to set about a particular number that would be, taken up when a patient comes to let's say a dental setting, which is called R naught, or in other words, we call reproduction number. Or in other words, say for example, if you get one infected can give this disease to another X number of people. So that X number is represented by R naught. So that is what we need to, remember. So therefore, in the world, people have found for past different viruses what this R naught number would be. Say you have say H1N1 1.2 to 1.6, SARS-2 to 4, and then COVID-19 it goes from 2 to 2.5. Right? But this 2 to 2.5 may not be appropriate for the indoors, or I would say confined settings. This particular number can go very high. So therefore, we have to find it out what would be the R naught number in your dental setting. If you can just make R naught less than 1, absolutely you have no risk. Or in other words, a infected person cannot give it to another person if the R naught is less than 1. But in any case, if the R naught is more or less equal 1 or more, meaning that this can pass it to another generation. So therefore, basically what we are looking at today is we are looking at, this R naught number. We will be calculating R naught number for different settings, different scenarios in your dental setting, and see where it lies. If it is less than 1, absolutely no issue. But if it is more than 1, or maybe more or less equal to 1, meaning that you got to do something to avert that particular situation. Otherwise, you will be giving this particular disease to another generation, and then definitely it will become a chaotic situation. So how this happens is it is through the transmission. This virus always transmit from person to person, and usually it comes from different modes. If you look at the modes of transmission, so this is what is given. I simply copied from WHO. I didn't want to change a single word. If you look at it, it says through droplets. That is the number 1. When you say droplets, the droplets coming out when a person, sneeze or maybe cough, even speaking, can, bring in droplets, and droplets can straight away go to another person, so that person then becomes sick. Or maybe through contacts. So that is maybe sometimes we call through even fomite. You basically touch a particular surface, and then the surface can have contagion, and that can go back to your mouth or maybe through nose, so that you get sick. So that is the second mode of transmission. The number 3 is aerosols. Aerosols is quite a small particles. They never come down. They basically hang around or become airborne. And that can bring the virus, to many people. So therefore, when you look at the WHO conclusion, which I have given here, you see the right hand, the bottom. And I would like to repeat that. It says WHO continues to recommend the droplet contact precautions for those people caring for COVID-19 patients. And also says WHO continues to recommend airborne precautions for circumstances and settings in which aerosol generating procedures and support treatment are performed. So unfortunately, you belong to the second category, meaning that you have to look into all 3 modes of transmission. Otherwise, people need to be careful of the first 2, droplets and contact. But unfortunately for y'all, you need to, careful of droplets, contact, and aerosols, all 3 modes of transmissions. So what do you protect yourself from? Unfortunately, all 3 modes of transmission need to be taken care of. Let us look at how we are going to do it. Now, this is just to give you a kind of an overview, understanding how the droplets and aerosol come out from, let's say, from event of a sneezing. You can see that the droplets can go even up to 7 to 8 meters. And then what you see in this cloudy type of thing is aerosol, which can go wherever possible. There is no limit for that. Remember that there is no limit. So what is given here in numbers or maybe meters are given for only for the droplets. Now, in the case of a cough, you can see that it can go up to like 2 to 3 meters. And if you look at in the event of exhaling, it can go up to 1. So that's how this 1 meter distance, what you call the social distancing, come from, right? So in the case of exhaling, it can go up to 1. But in the case of speaking or violent speaking or maybe sneezing, it can go even further away. So that is something that we need to, remember. But when it comes to aerosols, remember that there is no way that you can easily tell, okay, this aerosols go only up to like few meters, 10 meter, 50 meters. Always dependent on the aerodynamic behavior of the environment in which you are. So therefore, that is what we are looking at. When you look at this, everybody knows that you can easily protect yourself simply by having masks. So therefore, we will be basically going, so I have seen that most of the dentists go either for the, if you look at here, surgical mask, the first one, and then on your right hand side, you get the N95 mask. So just want to, give a little bit on this mask, because science behind this mask is very important for you to remember. Now, when you look at the surgical mask, you see that the blue color one is outer side. Outer side, it is basically to protect the large particles coming in. But, in between, you have what you call the electrostatic filtration layer, meaning that it would, whatever the viruses that are coming in will be adhered to that. And if you look at the third one, or the layer which is closer to your mouth, basically to absorb the breath vapor, right? Because whenever you talk, always this layer is going to be, basically blocked, or we should use the technical word we call soiled, right? Or it's going to be wet. So therefore, there is a limitation of this particular mask to be used. After that, this is completely going to be blocked. And then what is, important, the efficiency reduces. So therefore, one has to be aware of this. But when you're looking at the other mask, you could be able to see that it comes with 5 different layers. The first layer is to, basically to stop the larger particles. And in between, you have two layers which are going to, help adhere most of the smaller particles. And then, again, the final layer is just to, just to stop the whatever the splatter or the saliva going out, right? Because that is how it happens. But I mean, everybody knows that N95 mask seems to be the best, because it has quite a lot of layers, minimum 5 layers, some have even 6 layers, as opposed to the surgical mask. Why I have given this one is you need to, understand little on this. These are the methods by which we control most of the viruses. Look at the red color is virus. The other one, fiber, is what is present in your mask. That is what is given in orange color. And then you can see that it first, because of its, the speed, it comes and hits. So therefore, the first 2 are basically to stop the larger particles. And then if you look at the diffusion and electrostatic attraction, those are basically the mechanisms by which you, cut off smaller particles, smaller size, right? Even the nano levels can be protected from that diffusion and electrostatic attraction. So therefore, these 4 mechanisms are quite apparent in any one of the masks that you talk of, right? So therefore, we want these 4 mechanisms to take place. And then only we can say that this mask is pretty effective. Otherwise, the effectiveness drops. And this is what has happened when you look at the N95 mask. If you look at the right-hand corner, this corner, what you do is you basically cut off the larger sizes. And then smaller size, let's say viruses, will enter in. And then inside we have another 2 or 3 layers, which will help protect by diffusion and interception regime. And even when it comes further towards your mouth, what is most important is diffusion regime. So therefore, you can say outer side, always because of this impaction, the most of the viruses basically get stopped, and when it comes in diffusion takes the precedence, and always diffusion helps remove viruses. So therefore, this theory you need to understand. Why you need to understand is because you should understand how it protects you. Now you use the mask to protect others. Usually this is not the case, but still people, make use of mask to protect others. Now let's see this figure, right? There is no mask, meaning that there is no protection, right? That meaning that whatever the sick person, emits goes to another person. But look at what will happen if you have a surgical mask. If you have a surgical mask, you can see that 50% protection is there. Why 50%? Because there are leakages. Either side you get leakages, or even from the top and bottom you get the leakages. So therefore, when you wear the surgical mask, only 50% of contagions will not go, or in other words, 50% basically go out. And when you have the N95 respirator, remember 70% protection is there, meaning that only 30% leakages will go out. And with the electromagnetic respirator, which is more or less same as the N95, only thing here is, what is special here is this has cartridges, and you can be able to change the cartridges, and then you can reuse this respirator easily. But both have the same efficiencies. When you look at this, when you are going to, wear this to protect yourself, this is what is most of the time we do. When you go out, why you wear this is to protect you. Whenever you protect yourself with surgical mask, protection is only 75%. Or in other words, still there is a possibility of getting these viruses to you, so that percentage is 25%. And with N95 mask, 95% is protected, because this is fully sealed mask, right? This is fully sealed mask. So therefore, you can get yourself protected 95%, unlike surgical mask. This is also the 95%. So therefore, see the difference. Don't think that always the mask will give you the protection if you are to, protect outsiders, if you are to, protect yourself. So therefore, we have two different filtration rates. That is something that you should remember. And also when you look at mask filter efficiency, right? And whenever you use the surgical mask, we have a scaling factor. We have a scaling factor, meaning that it's going to be blocked by 60%. Or in other words, we say the real efficiency is 40%. But when you have the HEPA filter or HEPA mask, this is actually the HEPA mask. This is the HEPA filter which fits here. So therefore, this is actually a mask fitted with HEPA filter. So that gives 97% of filtration rate. Absolutely good. And this is much superior to N95. Remember, this is much superior to N95. So therefore, whenever you wear the mask, remember what is important is the scaling factor. Because you think that you are getting, you won't get filter all the viruses in. No, it never happens. So therefore, depending on the type of a mask, the efficiency matters. So therefore, always whenever you go for a very good mask, meaning that you get yourself protected very well. Otherwise, there are leakages through which it comes to you. Then the question is, how long you can be able to wear a mask? So this is the answer. Surgical mask can be worn preferably 3 hours, right? Remember that, 3 hours. But sometimes I have seen many of you wear for 8 hours, right? And even some don't want to throw it out. Some want to, use it overnight. So which is pretty bad. Why? This mask is going to be wet after 3 hours. Thereafter, you may not be able to use it. So then every 3 hours you need to change. But N95, you can use it for 8 hours. You can use it for 8 hours, but even after 8 hours, you have to throw it out. You may not be able to use it. This is not what I say. This is what many, countries, right at the moment adhere to. So this paper that I just wanted to show you, similar paper, similar incidence is given by French guidelines for the COVID-19, right? The entire, in France, they have been using, if you look at this, it's very clearly given, wearing duration less than 4 hours, see? And also it says must be changed as soon as it becomes wet. The usual practice is by 3 hours, this is going to be wet. So therefore you need to, throw it out, and then you have to have another one. Then the question is, are you prepared to do so? Or will it be possible in the government setting? So that is something that you need to answer. But when it comes to N95, again 8 hours, and thereafter it has to be thrown out. And again, you have to have another similar mask. So therefore, basically the most important question is the surgical mask, because many of us usually use surgical masks. So therefore, I don't think that we manage this mask only for 3 hours. We definitely wear this for longer number of hours, which we need to correct. Otherwise, you are more susceptible for the viruses to be, taken in. And some people see that whenever you do partitioning, you're going to, be safe. And this is the only study done so far using this computer fluid mechanics by 4 countries together, and see how the virus spreads. How the virus spreads. You can see both the aerosol and droplets goes when a person sneezes, right, in a corridor. This is the model one. This is pretty accurate, right? And for this modeling, they have used 2 days, 2 days of computer time for this. You can be able to say that it has gone, just above to the other room as well. So therefore, don't think that if you are in a kind of a partition, you are safe, right? So therefore, there is a possibility for you to get contracted. So therefore, we have to be a bit careful. So therefore, that's why I say that the indoor environment seems to be pretty bad. And if you want to read more on what I have done so far, now this is the paper that I have published, and which is given, and then from Science Direct, you can download this. This is free, and you can download and read. Then you get a lot of science that I have, spelled out up to now with more details. And then the third type of transmission is foamine, or maybe surfaces. Why I put this one is because you're basically cleaning most of these surfaces just after, let's say, an activity. But look at the last one, the outside of the surgical mask. Now, this is why I just want to highlight, because I have seen many of you basically touches the outside of this surgical mask. And when a virus goes in and it remains there, viable 7 days. See, it is viable 7 days on the surface of outside of a surgical mask. So therefore, whenever you throw this out, you have to be extremely careful, because the viruses can, basically stay there alive, and we have to be very careful when you just dispose of these masks. When it comes to Sri Lanka now, let us look at, this is the Sri Lankan picture, how we record the daily cases. What you see in green is asymptomatic infection patients, asymptomatic, right? Initially you get symptomatic, but nowadays what you get is asymptomatic. Then the question is how to identify asymptomatic. There is no method by which we can identify asymptomatic unless you check, through using the PCR techniques. So therefore, this is a classic video, because we do not know whether the asymptomatic patient can, throw out whatever the contagions, or maybe this the COVID-19 virus, so that others could, get contracted. We don't know yet what could be the amount. Now, this is the head of technical section of this WHO. Please listen what she says.
that suggests that anywhere between 6% of the population and 41% of the population may be infected but not have symptoms, with a point estimate of around 16%. I don't want to get too technical, but that we do know that some people who are asymptomatic or some people who don't have symptoms can transmit the virus on. And so what we need to better understand is how many of the people in the population don't have symptoms, and separately, how many of those individuals go on to transmit to others. And so what I was referring to yesterday in the press conference were a very few studies, some 2 or 3 studies that have been published that actually try to follow asymptomatic cases, so people who are infected over time, and then look at all of their contacts and see how many additional people were infected. And that's a very small subset of studies. And so I was responding to a question at the press conference. I wasn't stating a policy of WHO or anything like that. I was just trying to articulate what we know. And in that, I used the phrase very rare. And I think that that's misunderstanding to state that asymptomatic transmission globally is very rare. What I was referring to was a subset of studies. I also referred to some data that isn't published. And this is information that we receive from our member states through either presentations that they give at member state briefings or presentations that are given to us through teleconferences. As you know, and as we've said previously, we convene global expert networks. And at many of those, we discuss a lot of ongoing research, ongoing studies that are there. And I was referring to some detailed investigations, cluster investigations, case contact tracing, where we had reports from member states saying that when we follow asymptomatic cases, it's very rare, and I use the phrase very rare, that we found a secondary transmission. What I didn't report yesterday was, because this is a major unknown, because there's so many unknowns around this, some groups, some modeling groups have tried to estimate what is the proportion of asymptomatic people that may transmit. And these are estimates. And there's a big range from the different models, depending on how the models are done, and where they've done, from which country, but some estimates of around 40% of transmission may be due to asymptomatic. But those are from models. And so I didn't include that in my answer yesterday, but wanted to make sure that I covered that here. That suggests that.
All right, so what it says, so 10 to 40% could be because of asymptomatic patients, so that they can also contract others. So that is something that we should understand. So when you're looking at dental settings, you just ask certain questions. You know that aerosol generating procedures seem to be unavoidable. Of course, now you are not doing, but the question is, can you be able to stop these procedures right over? It's going to be very, very difficult. And because of these aerosol generating procedures are on, you got to think of all 3 types of transmission in your dental setting, how to stop all 3. And another disadvantage for you all would be that you need to work in a restricted indoor setting, meaning that you're going to be exposed to all 3 in no time. And another issue for us is, whatever you do, you may not be able to identify COVID-19 patients, mainly because of the fact that many of them are asymptomatic. So therefore, you check temperature, you ask 1,000 questions, but it's going to be very difficult for you to identify asymptomatic patients. So therefore, I would say all the time that every patient that comes to the dental clinic, you got to understand, you got to presume that that patient is suffering from COVID-19 and it's going to be asymptomatic patients. Otherwise, there is no way that you can resolve this matter. And remember, you are subject to a very high degree of risk. Why? You generate splatter and quite a lot of aerosols coming out from the mouth. So therefore, you are at the highest risk level. Invariably drives you to equip with all precautions. So you need to, go for all precautions that are meant for droplets, aerosols, and foamine. And the question is, are you prepared? So that is what you need to, remember. So when you try to, solve these problems, I know that most of you have preconceived ideas. And I got from many dentists saying that we should reinstate good practices of all type of hygiene recommended by your institute. That's what you have been doing. basically wear, mask, and then you clean up your hands all the time. And also many believe that you need to switch off air conditioners. And many believe that you have to open windows for natural ventilation. At the same time, some believe that you have to switch off the ceiling fans. Now, what I'm now going to give you is the scientific, the understanding or the answers for all of these questions, right? Right at the moment, I know that you have varying ideas on these issues. What you need to do, you should ask these questions your authorities. What you should do is you should go and then ask your authorities. You ask, can you do away with aerosol generating procedures? Very unlikely. Now you can say yes, but definitely it will, come on little later. What happens if asymptomatic patient visits? Are you prepared? Because no protocol for the identification, you don't know. You are not prepared at all. Then another question is, can you work for long hours, 6 to 8 hours in a restricted setting? Nobody knows the answer. Can you put your life on the line? Everybody knows, not at all. Nobody wants to get contracted this disease. So therefore, everybody is very keen to stop this, getting onto you. How do you know whether you have adequate ventilation? Absolutely, you have no idea, right? What happens if your fellow colleague accidentally handles COVID-19 patient and becomes asymptomatic person? Still, you have no idea. You don't know how to, manage. Is there anything that you could do to prevent you from being contracted? Yes. Everybody says that, okay, I will wear mask, practice hygienic etiquettes. So that's what you do. But I just want to say that that is not enough. Is there anything you could to fizzle out the risk on your spouse, children, and siblings when you go home every day? Not at all. So you don't know whether there is a risk that you are going to, pass it to your relatives, your, parents, children. So still you don't know. So therefore, these are the pressing questions that are going to be before all of you, for which there are no answers for the time being. So let me, find some answers for these burning questions. That's what I'm going to do. How you're going to do this is that now you're going to model this. Whatever in the environment can be modeled, that is what I'm now going to do. That's why I'm now going to give a try. Now this, what I'm now doing came quite recently. Until recently, we have absolutely no way by which we can calculate it. Now it is possible through this particular journal paper. So you can be able to download and read it. It says the estimation of airborne viral emissions, or in other words, we can calculate the Quanta emission rate from a COVID-19 patient, and then you can do the risk assessment. So with the risk assessment, we can say that is there any risk for any susceptible host. So therefore, this came towards the end of May. So thereafter, now we can be able to calculate. So what is our approach? Our approach is basically to do the risk assessment in indoor environments by simulating the airborne transmission of virus during an epidemic, right? So to this end, we need to collect the air emission data, right? Which is basically a new approach, and it is based on the viral load in the mouth. Say, for example, infected will always emit viral load, which we need to know. Then the type of respiratory activity, whether you're breathing, speaking, whispering, or all matters. Based on that, the respiratory activity always matters for whatever the content that is coming out. And also respiratory physiological parameters, for example, inhalation rate. Now, you know that whenever you have a mask, you inhale pretty fast. Or in other words, what you do, you exhale also pretty fast, meaning that you are putting, fairly a large, quantity of a virus onto the air, right? So it should be called a payload. A payload seems to be fairly high whenever you inhale pretty fast. So therefore, depending on these, factors, now we can be able to calculate what is called this Quanta coming out from an infected person, right? So that is not a new theory which has come out very, very, in 1955 for the first time. And there is a person called William F. Wells who defined a quantum, right? A quantum, when you say a quantum, it says one quantum is going to 63% of the susceptibles in a given environment. Now let's say you have a room, you have 100 people, right? There is a particular threshold level of viruses that could make 63% of your people sick. So that is called the quantum. So therefore we go by Quanta. So therefore now we can be able to calculate this Quanta, right? So Quanta is what is coming out from an infected person, but the content, the amount of Quanta changes based on the activity that particular person is in. So therefore we need to collect all this data for you to calculate the Quanta. It is given by this equation. I'm not going to go into the details, but if you look at that paper that I have shown you earlier, you can be able to calculate by yourself. The important thing is ERQJ, that is the Quanta emission rate. So that is dependent on so many other parameters which is given here. So this has now been measured. So all the viral RNA copies that is coming out from from the mouth of an infected has now been measured. So since it has been measured for the COVID-19, we can now be able to identify or measure this Quanta emission rate. Okay, so therefore that comes from this equation. Since we know almost all these parameters, we can now calculate. But we need not to calculate by this equation. It has been given in basically charts. We can very easily get it. And then what is important is for us to find out this Quanta that is present in your environment air with the time, right? Now say, let's say you have the patient coming now and the patient starts emitting Quanta and he's going to be in your environment for 10 minutes, and for 10 minutes he has been just emitting this Quanta out, and thereafter he might go. It does not mean that the Quanta is going to be zero. The Quanta takes some time to completely be taken out from your environment. That is through your ventilation, it will be taken out, but it takes time. So therefore this equation calculates, let's say for every minute, what happened in your setting, dental setting or dental clinic. We can calculate starting from t equals 0. Let's say for 3 hours, every minute we can calculate, right? So therefore you can see what would be the Quanta level in your air, in your dental setting. If you know the Quanta level, you can calculate R. R is actually the risk factor. This is again, all these equations are very, very famous equation in epidemiology. If you know the principles of epidemiology, everybody knows these equations. But I don't want to go into much details. But what you do is you calculate the infection risk. If you know the infection risk, now you can calculate R naught, most important number, right? That what you do is you multiply R by the number of susceptible persons, then you get the R naught. If R naught is going to be less than 1, so your dental setting is perfect. You don't want to do anything. You can keep on working. You need not to be worried. But supposing if R naught is equal almost 1, you have some risk, moderate risk. You have to be now careful. But in any case, if R naught is going to be greater than 1, you cannot do. Meaning that people who are there are going to be sick if an infected person comes. That is what you need to remember. Okay. Let us look at this. Now this is the graphs from which we calculate ER or maybe the Quanta, depending on any activity. Look at here, when a person sleeps, from this you can find out what would be the RNA copies that is coming out from his mouth. Come this way, go this way, you can find out ERQ. This is the Quanta. When a person standing and then if he just emits some of these viruses, still you can calculate from this graph. Then when he does light exercise, moderate and heavy. All right. And also you have something here that is, say for example, this one CI usually we call 0.1, that is we call infectivity. Infectivity is 0.1 if you find symptomatic patient. If you find asymptomatic patient, it is going to be only 10% of that of symptomatic. So that's why 0.01. Or in other words, always one order of magnitude is less, when asymptomatic person, emits these viruses. Or in other words, the asymptomatic patient always emit less viruses than symptomatic patient. So therefore, we from here point onwards, we take all the time asymptomatic case only, because we know that the symptomatic cases won't come to your clinic. And since you can find it out, you can very easily figure them out. But asymptomatic you can't. So because of that, we will hereinafter consider all the patients are asymptomatic. Now this is, we did the modeling. Now let us look at, this is a dental office. In the case of a dental office, here you are there. There are two people. The room size is given. There are two susceptible individuals, meaning that they have no disease, but you have disease. Let's assume you have disease. But nobody knows that you have a disease because you are asymptomatic. In a case like this, the Quanta inhalation rate by the other two is this, 110 Quanta per hour, right? So when you put this into this graph, if you look at this graph, see, you start from 0 to 10 minutes, meaning that you are there, right? T equals 0, but at the same time, other two also enter into your room, right? As soon as you enter, you go to your room with another two, and both the visitors are going to be in your room for 10 minutes. If they are going to be in your room for 10 minutes, you look at the risk factor R0. We calculate R0 for air conditioning, ceiling fan, natural ventilation, right? But in this case, I just want to show you the most, the safest one is natural ventilation. See, it is, at the bottom. Then ceiling fan, air conditioning is first. Now this case, if you look at, you're there for 20 minutes, right? And after that, these two susceptible host, or maybe some people will enter your room. Then they have this risk. R0 is still less than 1. So this case and that case, no issue at all. Even if you look at this, after 50 minutes, no issue. After 110 minutes, even if they enter, R0 is less than 1. So what it means, absolutely in your dental office, if anybody wants to be there for 10 minutes, you don't want to worry, irrespective of your ventilation type, whether it is air conditioning, ceiling fan, or natural ventilation, absolutely no problem. They are safe. Then what will happen if these two wear mask? That is, definitely they are going to wear this surgical mask, right? If they have the surgical mask, see, these are not further drops. See, are not values further drops. Look at the Quanta level, 27.5, very much less. Why? You won't get everything what is in the environment because it has to filter through, through this surgical mask. So therefore that level become less compared to the earlier case, right? And then what will happen, all three, where still it is less. It's going to be very less. Now look at the Quanta inhalation rate in the environment is 13.8, because even this person, sends out a less amount of Quanta, right? And also the other two also inhale less amount of Quanta. So because of that, you can see R0 becomes very much smaller. So therefore, in other words, what I want to say is, you have no issue in your dentist office, provided that two people or maybe even more stays there for a shorter period of time. If they are going to be there for more hours and hours, definitely they are going to have issues, right? So therefore, always make sure that you restrict the number of hours that the strangers stay in your room. So therefore, you can be able to safeguard most of others. Now the question arises. Now look at, you are going to do, now look at this day 1, right? This is how a dentist work in the private clinic. I'm looking at only the private clinic today because otherwise it's going to be not easy. 3 hours and 15 minute session. Okay. Now this is the procedure. Look at 1, 2, 3, 4, and it goes up to 10. First consultation, and then after the patient goes after consultation after 5 minutes, you do the cleaning. This number 2, there everywhere you can see this blue color, meaning the cleaning of your place. You know, your assistants will clean because that is to get rid of the fomite, you know, transmission. So you do cleaning, and then a patient comes here, number 3, for dental extraction. Then number 4, temporary restoration. Likewise, you go on to up to like 10, you know, for composite restoration. So for that, you have a different time intervals. Okay. Now let us look at this. What will happen if a patient comes here with the COVID-19, then when he enters, he start, you know, producing or maybe emitting Quanta, and it goes up to this. And after this, he goes out, but still you have this Quanta in the air, and this, because of your ventilation, it drops like this, right? And after that, it becomes 0, right? So then under this, the dentist is going to be exposed because the dentist is going to be from here to end. So therefore, under this curve, you know, I just want to, you know, see the risk associated with the dentist, right? We calculated it's going to be 0.29. Dentist has a risk of 0.29, or R naught is 0.29. So it's going to be less than 1, so that you have no risk. But remember, here, dentist here with N95 mask and air conditioning on. I'm not going to, you know, discuss anything because in most of the, you know, dental settings in Sri Lanka, you have air conditioning. You cannot go for other types because the setting is not amenable for that. So therefore, look at, if there is a dentist with N95, you have 0.29, you know, R naught value. But supposing here, right, if you go to number 5, meaning anterior root canal treatment, right? When a person comes here for this root canal treatment, he keeps, you know, emitting the virus, and he finishes here and then he goes out. But it takes some time for this virus to go out of the environment in your setting. When in a case like this, the dentist is going to have R naught of 0.5. See, likewise, what will happen when a patient comes to 6? You have this much of R naught. When a patient comes here, you have 0.41. When a patient comes 9, the most, you know, difficult part. Why? 45 minutes he is going to, you know, spread. 45 minutes he is going to spread. So there you can see that the R naught is pretty high compared to all the others, right? This is what the doctor is going to get. So this is less. So therefore, if you look at all of them, what you can say, dentist doesn't have a risk, right? Because all less than 1. But remember, this is true only if dentist wears N95 mask, right? So now there is no problem for dentists. You all do not have problem. Let us look at what is going to happen for your assistants. So same thing with assistants. Look at with the assistants. Now you have 2 assistants. Remember, you have 2 assistants, right? And with surgical mask. So you basically give your assistant surgical mask. Now they wear surgical mask. See the values are not 1.65, 1.95, and all are greater than 1. What does it mean? If a patient comes, let's say even at 3, 5, 6, 8, 9, or 10, right? For whatever the activity that comes under these time intervals, assistants are going to be exposed to high contact levels. So therefore, they are going to be get contracted because it is going to be greater than 1, right? So therefore, the best thing is do not keep 2 assistants inside whenever you get involved in these activities. Keep only 1 assistant, let the other assistant stay outside until you finish. So therefore, this risk R naught value drops by half. So you can make it half, but still here there is a problem. So therefore, in other words, what I want to say, give you is your assistants are at a risk, provided that you give them the surgical mask. Or in other words, if you want to work, you got to give them also N95 masks. Otherwise, there is no way that you can make sure that they are not going to get contracted. So they are definitely going to contract. So therefore, please be careful. So that is one of the conclusions that I can give you whenever you do this particular procedure. Now let us look at what will happen when a patient comes after COVID patient goes off. All right, this is a patient. What it means is, let's say if you look at this, now the COVID patient comes and he, drops out all of them. He leaves, and then you bring another patient to do number 6. And then the patient who is going to be here, he is going to expose from here to here. This area he is going to expose, right? And then when you look at that, he has this much of risk. Oh, R naught is going to be 0.95, right? And even 0.97, 0.97, which is moderately high. Or in other words, after a COVID patient goes, if another new patient comes, he doesn't have any COVID, but he is going to get contracted this disease because it is more or less equal to 1. We say you have a moderate risk for a patient, right? To stop that, what you have to do? You have to increase this time. Why this? This is, we have kept only 5 minutes. You kept only 5 minutes in between. See, every activity you have kept 5 minutes for cleaning. Theoretically speaking, this has to go more than 15 minutes. The question is practicality. Yeah, I know that you may not be able to practically impose this, but whether you like it or not, that is the truth. That is what you need to do, unless you give them the N95. But unfortunately for the patients, you can't give anything, right? The patients need to just open their mouth. They cannot have any mask on. So because of that, if you have to safeguard the lives of the patients who are coming after a COVID-19 patient, make sure that this 5 minutes needs to be increased. Roughly, I calculated for this dental setting, you got to increase this for 15 minutes or more. Preferably 15 minutes, but it is much safer if you can go for more than 20 minutes. But I don't know whether it's practical or not, but you can reduce the risk on your patients if you're going to increase this to 20 minutes. Now let us look at a similar one again for day 2. Day 2 is another set of activities, right? So this is another set of activities because I was asked to look into this set of activities as well. Look at the dentist, right? Only thing is you have a different set of activities. The rest is same, right? Dentist has now N95 mask worn. You can see there is no issue for the dentist. Dentist is safe because the dentist has N95. Look at the risk involved with assistance. Almost every value is greater than 1, meaning that your assistants are going to have issues, right? So therefore, again here, I would advise keep it 1, but even for that person, you got to give them N95 mask. Otherwise, your assistant is on the line. So definitely he's going to get the disease if, let's say, a COVID-19 patient visits you. And look at the patients. Even the patients are having the same here. So patients are also not safe, right? To solve this one, unless you change the ventilation, you need to keep more time in between, not 5 minutes more, right? But there are some solutions, engineering solutions that you can, apply, keeping this particular gap even 5 minutes. That I'm going to, give you later. Okay, so now we are going to go to, aerosol generating procedures. You have another same one. Look at certain places like 5, activity 6, activity 8, 9, 10, all have aerosol generating procedures. If you are to go for aerosol generating procedures, you can see that the risk for the doctor, the dentist, is also high. Even though you have N95 masks, see, or theoretically what I want to say you is, you cannot do aerosol generating procedures in your settings, in your clinics with only N95 mask, sticking to the same ventilation that you have had before COVID-19. You got to have something, change in your settings, with engineering devices. Otherwise, you may not be able to, practice the activities producing aerosols. So that is something that you need to remember. Look at the risk for the assistants. It has gone too very, very high. See the same thing for the patients who are coming later. See, every person has, when you say one, meaning that definitely he is going to get contracted. So therefore, aerosol generating procedures cannot be practiced with the present setup as it is, unless you do some engineering interventions within your system so that the ventilation seems to be fairly high. Okay. So look at the same thing for the day 2. Earlier I showed day 1, now the day 2, same risk for the assistants, same risk for the patient, right? Same risk for the patient. Or in other words, the aerosol generation procedures, whatever the sequence given, you are not safe enough. Definitely you need to do certain modifications, without which you may not be able to, go ahead with your private clinics. So that you need to remember. Okay. So this is what you do. I just want to, give you some ideas. Without aerosol generation, absolutely no problem. You have a doctor, you have one, the assistants, absolutely no problem. To a certain extent, you are safe. But whenever you produce aerosols, now this is what is going to happen with AC on. And you see very clearly the assistant blocking the path of the AC. What does it mean? You are trying to, get all this splatter, or maybe I would say droplets and aerosols within your area. So you are much more susceptible to inhale most of these loading. Theoretically speaking, this assistant should not cover the path of the AC. He should, she should move a little away so that the direct path will come in. So therefore, most of the aerosols will, taken away from both of you. I mean, the doctor, the dentist, and the assistants are a bit safe. So therefore, the position where the assistant and the doctor stay within the given setting matters a lot. So therefore, keep that in mind. And this is what you call the natural ventilation. When you say natural ventilation, the ventilation should come from one end, it should go from the other end. Otherwise, it is not effective enough. If you have only one window, don't think that it would bring all of yours, the aerosols taking out. Never happens. So therefore, we have to be very careful whenever you talk of natural ventilation. You have to have what you call the cross ventilation. Either side, you have to have openings, without which you may not be able to be safe enough. And whenever you have a fan, and then you have to be extremely careful, right? Then just to give you just some glimpses, look at what is going to happen in your settings, or maybe a healthcare center, or maybe in hospitals. Now you can see that the patients are there. You have the AC. AC will bring everything, towards the other area, and it goes back to the AC. Remember, these are the flow directions. So therefore, whenever there are infected people, so the viral will always go up, and then from the AC it comes back, because your AC doesn't have a HEPA filter, right? If you don't have the HEPA filter, remember 50% of what goes will come back. So therefore, having an AC without a HEPA filter is pretty dangerous. Why? It brings back whatever the virus into your environment, so that the others have a high chance of getting it contracted. So that's something that you should remember. And look at what will happen if you have infected person with surgical mask, less. You can see that these two pictures. But if the infected person wears N95, you get very less. So therefore, either side people are affected. On the either side people are protected. Okay. So therefore, it is important even for the patients to wear the most of these masks within the indoor setting. That would help others very much. So therefore, that is something that you should remember. But in the case of fan, look at this. What fans does is it circulates, all the time, up and down. It goes up on the top and then it comes back to the bottom. So therefore, that is something that we should remember. So therefore, I would advise not to have the fans on, because the fans would not help you remove most of these viruses from this environment. It's basically circulate within the same environment, right? Even if you have this different mask, so the effect would be less with the mask worn, but still the effect remains within the environment, same environment, right? It will not be eradicated completely with the fans on. And then it's quite important for you to remember, once you finish your work, what you do, you get into car and you go home. And this is the pathway how the air conditioner gives you breeze, right? It goes passing you, sweeping you, and then it comes back and goes to the bottom. So that is how the circulation takes place. But look at, if there is a patient behind you, it goes up and then it comes back to the same person, or maybe the one who is next to the infected. And basically it affects all 4 people, right? So therefore, whenever you have the AC on, you got to be very careful. So therefore, never go with AC on if you feel that your neighbor in the car suffers from the COVID-19. Look at what will happen, right? So even though you have this mask, there is a percentage of risk that is involved. With the surgical mask, 2 people can very easily get contracted. With N95, 1 person can get contracted. So these are all mathematically proven. We can prove this, which I have not given here because of the time. So usually you can be able to, but ideal would be this. Whenever you go home after working, best thing is to keep all 4 windows open. So that would help change your air pretty fast. So therefore, even though you have in your gown or in your whatever you drape, if there are contagions or maybe virus, that would basically swept away easily. So this is the classic case. I don't know whether you could remember our first Sri Lankan index patient is actually coming from this tourist the sector. So he got contracted and he went to a doctor. The doctor said that he got some symptoms. Then what happened? He had to go to the Angola hospital. The journey was more than 30 minutes. And then his son drove the car. The wife was in the front seat and he was behind. But what he did was, right throughout, he opened the window. So therefore, because of that, his wife and his son did not contract the disease. So therefore, that is one of the best way, because the ventilation is pretty high when you just open, and then you can get rid of this disease very easily, right? This is what I just want to show. And then we need to look at the answers for your questions. Everybody knows that reinstate good practices, all type of hygiene recommended by your institute. Yes, you should do, but not alone adequate. That is what I just want to see. It is must be practiced, but only the mass or whatever this keeping clean or having the best practices as your the institute recommends, it is not enough. So that's why I say must be practiced always indoors. This has to be practiced always indoor. But I have not seen people coming into your dental clinic going back with hands clean. The most important part is when a person comes in, I know that everybody cleans, but that is not what is important. The most important is indoor air contains more viral loads. You have seen the Quanta numbers. So therefore, make sure that everybody, going after the, let's say, any activity, he or she should be able to clean himself, so that would prevent others getting contracted. So therefore, make sure that you do that, but not the vice versa. But I'm not saying that vice versa is bad. It should also be done. But the most important part is when a person goes from the indoor out, then they should be able to, practice these etiquettes. That is very important. Switch off air conditioners. Now, that is what you think. Good, provided that you have adequate natural cross ventilation. If not, stop all aerosol generating activities. That has to be done. Otherwise, there is no solution for you. Should be the best option, but difficult to practice, hence only option available in dental setting. Whether you like it or not, this is the only option available for for the time being for most of the dentists. So therefore, invariably, we have to go for this. Then open windows for the natural ventilation. Can we be able to do this? But I do believe that you cannot do it because you don't have what you see here is cross ventilation. This setup is not there in most of your dental settings. If this is not there, so do not go for open window, or natural ventilation will not be there for you. So therefore, my answer for you would be, do not rely on natural ventilation because you don't have that proper setting within your the clinics. Switch off ceiling fan, yes, that would help you a lot, because that seems to be a good option for you, because when you put the ceiling fan, it will always agitate. It will bring the most of the virus up and down many times. So therefore, that is a good option. So therefore, you can have some idea now what to do within your area. Now, as I mentioned, you know that you cannot do some of these activities, particularly aerosol generating activities, without some engineering solutions. Now, this is one of the best solutions that I can, suggest. This is quite, possible in Sri Lanka. And the person who wears is the inventor, one of the Sri Lankans. Now, this is called Atom Blue. Atom Blue, this is actually available. And in USA, this is very much sold to dentists. Now, you can see that this is, there is a magnet here. You can basically glue this into this. Now, what you see here is HEPA filters, right? So therefore, you have the HEPA filter. This unit can be used over and over again. And inside there is a fan. If you try to, inhale, let's say vigorously, the fan, works vigorously. So therefore, you won't feel it, right? Even having this would help you run without any issue. You have no problem of breathing with this. So therefore, this type of thing, I would believe that almost all dentists should wear while you are engaged in the work, right? Or else you have to go for this aerosol sucking devices, right? If you look at this, sorry, I forgot to tell you, this price of this would be like $120. This one is $120. When you look at this sucking machines, a good one is going to be $500 to $600, right? So you can be able to, keep it like this. And then whatever the aerosol splatter that comes out will be sucked in. And that would take out. And then inside here, there is, in fact, machine or device which will basically destruct or maybe completely kill the bacteria. So therefore, you are going to be safe. Or in the environment, you get minimum amount of contact. But if you look at very carefully these two, assistant and the doctor, you can see that they have the HEPA filters. See? But in your case, you don't have the HEPA filter, but instead of that, you have the N95 and also the shield. But I would say that they are not going to help you like HEPA filter. But if you have HEPA filter, you will guarantee that the viral load that you breathe is very bare minimum. So therefore, in the long run, I do believe that you should have something like this. This is what I shown here, right? HEPA filter. Or else you can, have this. Now I told you that you have your AC fixed. So nobody wants to remove this AC and then, fix another one, right? Nobody wants to do it. But you can fix a small gadget. This is called a bipolar ionization unit. You can fix this one. With this, it produces the the OH radicals, hydroxyl radicals and hydrogen peroxide. Both of them are very good oxidants. They will go and then kill the bacteria because they adhere and damage the corona. And when they damage the corona, the the virus is going to be killed. So therefore 99% of bacteria can be killed using this. Not only that, this gives you some more other benefits, like say all polluted air. So whenever you are working inside a small area, carbon dioxide and carbon monoxide is going to be high. But this would eradicate carbon monoxide as well. Or in other words, indoor air quality cleaning can also be done by this small unit. This is enough for 300 square feet area, and roughly the cost is 35,000 rupees. What you need to do is, you need to plug in through DC current and then just closer to the AC. So therefore that would start producing ionized, the element, so that would kill most of the bacteria. So therefore the actual Quanta level that is present in your the environmental setting, dental setting, is going to be less. If it is less, meaning you are going to, the doctor or the dentist or even the assistants or even the patients basically breathe less amount of contact. So therefore their risk factor is drastically reduced. So therefore you can be able to go either of these. All of them are available in Sri Lanka. All of them are available in Sri Lanka, but at a cost. So therefore it's up to you to decide exactly what to do. Now, when you are looking last, slide, these are the answers that you need to, that I can be able to give you. Wear PPE, whatever possible, and adopt correct methods of donning and doffing. That's quite important, right? That's quite important, because without that, you may not be able to reduce the whatever the Quanta levels that are present in the air. Use rubber dam, but which is very, very not very common in Sri Lanka. But in Europe, many dentists are using this rubber dam. But if possible, you can be able to use it. So therefore, whatever the splatter coming out from the mouth would be less. Use adequate hand hygiene when coming out of the clinic. This is what I want to highlight here. Please remember, whenever you go out from your clinic, do the hand hygiene as much as you could, because you're bringing most of this stuff home, because your environment is full of the viruses if there is a COVID-19 patient in. So therefore that's very, very important. Use appropriate ventilation improvements. You can do, as I mentioned, shown you earlier, mini air suction devices, HEPA filters. You can be able to fix it. So if you fix this, the actual amount of Quanta present in the air is going to be less. So therefore the risk for all people who are there inside your clinic would be less. Use bipolar ionization technique to destroy viable viral loads. I always recommend this because this is the best option available at the time for the world. Many, it's need not to be your clinic, even at your home, even in your office, in your, wherever you are in the indoor. So bipolar ionization is the best. So therefore you can be able to, just go for a small unit, which can, basically be there for more than 5 years. So that easily you can be able to, generate the ionized air, which are much, much cleaner. Then clean all surfaces after patient with an alcohol-based disinfectant. Why this is important? And this will help you remove whatever the transmission, through fomites. But the problem is time. Now, basically, you spend only 5 minutes, right? But I would say you need a little more time. Within 5 minutes, you may not be able to do the entire thing. So therefore, I do believe that you need to take a little more time to clean, because there are certain surfaces which you can't, which may not see. So therefore, you got to make sure that you do a thorough cleaning. That's quite important, because the biggest problem is a fomite, right? Because the splatter comes out. When the splatter comes out, basically goes everywhere within I would say a range of 8 feet. Then the next one is remove and keep all your disposable PPE in a container filled with a disinfectant for at least 3 days before disposing. That is a very important one because most of the time disinfectant for us would be chlorine. Whenever you put your stuff in, and still the viral can be viable for 3 days. So therefore one has to be very, very careful when you dispose of what you wear. So therefore, don't just put it, to the normal garbage bag, but make sure that at least you have, a certain disinfectant fill a bucket to which you are going to, just dispose everything, all the disposables. And again, I would say anything you feel comfortable, you can be able to use it, but make sure that they are scientifically proven. That is what is most important, right? Or in nutshell, what I want to say you is your dental clinic is not safe enough. Without aerosol generating procedures, dentists have no issue, but the assistants and the patients who are coming later are going to have problems. But whenever you produce aerosols, through your activities, neither of these people are safe. Or in other words, doctor or the dentist, assistants and patients all are on the line. So they have the risk. So therefore you need to, make sure that you have some of these solutions that I have mentioned to get rid of this problem, right? Because the main problem is we are not in a position to identify some of these patients because they are asymptomatic. Because of asymptomatic, we cannot, very easily tackle these problems. So therefore, I just want to say last, be ready, do everything, and be safe. So that would help prevent the COVID-19, transmitting from one generation to another generation. Otherwise, it would, spread everywhere. So therefore, it is, up to you to, protect yourself and protect others as well. So you have a bigger role to play. Thank you very much. Thank you very much. So that's all.
Right. Thank you very much, Professor Mahesh Jayaveda, for that very good presentation, which is very stimulating for almost all the clinicians who are here. So we have few questions posted. So the first question is by Professor Aruna Tilakaratna, and
Yes.
she's asking if partitioning doesn't provide protection, what would be the use of face shields for protection?
The face shield would help you, get rid of the droplets. Because the issue is, if the droplets are large, I would say more than 5 micrometer, yes, you can be able to protect. But unfortunately, when the splatter comes out, most of the droplet becomes what you call the droplet nuclei. When the droplet nuclei comes out, so then they become airborne. So if it is going to be airborne, it comes through to your, in fact, nose, through different parts, right? Because you have to, basically breathe. If you breathe, it will come in. So therefore, why you are going to have this, whatever the shield, is to protect, the large droplets falling onto your face. That's all.
Okay, so together with that, there is another question from an anonymous attendee,
Sure.
which asks about the same thing. Do you advise the use of face shield with a mask for consultation or examination only procedures?
For me, actually, this shield is of no use. Why I say is because if you have, let's say, a good mask, that would protect you from droplets, and also it would protect you from aerosols, right? Both can be done with one mask, but it has to be, I would say, a mask with HEPA filter, right? Because if you have even N95, now you have N95, and after that you have the shield, but both would not help you remove completely the aerosols. Because our issue is the aerosols.
Yeah.
Our issue is the aerosols. The droplets, you need not to be worried that much, because with whatever you wear, So basically, the droplets will be, completely eliminated, but you cannot eliminate aerosols.
Right. Thank you very much for that clarification. And there is another question from Dr. Shashini Navaratna. She's asking, what is the difference between N95 and K95 masks?
Yeah, N95 is actually the American standards, or the European is also, we have a European similar one, PP1 and sorry, FFP1 or 2. So K95 is Korean standards. But when you look at N95 and K95, theoretically same. There is no difference. Since it comes from Korea, that is called the K95. Otherwise, there is no difference at all.
Thank you. The other question is from Dr. Amodini. She's asking, she's saying, thank you very much for very informative lecture. And some people think that having an exhaust fan fixed right above the mouth of patient with tubing that carries the exhaust to a higher level, similar to a chimney, will help with reducing the amount of aerosols within the dental surgery. Is it actually helpful?
To a certain extent, it will be helpful, yes. But the issue is, I don't know the levels of the extraction speeds, because sometimes the extraction speeds are not enough to, extract everything. So therefore, one cannot say, without looking at how it works. And supposing if it doesn't work properly, what goes in stops at a certain level. Because whenever you design the extraction system, always we look at what you call the negative pressure. If there is a negative pressure, absolutely no problem. Sometimes you cannot have the negative pressure. In that case, so what will happen? The aerosols and everything goes up to a certain height. Beyond that, it can't, go, because there is no enough pressure. So in that case, very, very serious, because you bring everything into a certain height and there it stops, right? So therefore, I do not advise for you to go for normal, this type of device, unless it is checked by an engineer or a technician. If a technician says or engineer says, absolutely no problem. You can be able to go with it.
Okay. Thank you very much for that. And the next question is by Dr. Chaturangani Gunathisa. And she's telling, thank you, Professor Mahesh, for the very informative lecture. What is the use of installing exhaust fans in our setup? Does it have any effect?
Yes, that would be good, because whenever you have an exhaust fan, what happens is, whenever a patient comes in, the patient always emits this Quanta, right? And I would like to use this word Quanta, because the Quanta is which is going to, make people sick. Now, if you can be able to, lower the Quanta level present in your dental clinic right throughout, that is what you should do. So now for you to do that, the ideal would be to, go for even exhaust, devices. When you have the exhaust devices, what it does is it sucks out most of them and then try to throw them out. Or in other words, the amount of Quanta that is present in your air will be reduced. When you reduce this the Quanta level in the air, anybody who breathe that Quanta levels would be less. So therefore, people do not have a high risk, even though they breathe whatever the air fill in the Quanta. So therefore, that is ideal. But as I mentioned earlier, you got to, get it checked by a technician or an engineer. Otherwise, we don't know whether it is completely taken out or not. Okay.
Thank you very much for that descriptive answer. So the next one is by Dr. Gayani Taranga. She is asking, are government clinics, there are minimum 4 chairs functioning in a single AC room at one given time?
Yes.
How the risk can be reduced?
Risk is 3 times greater than what I explained today. Because, I have seen this one. Actually, I just worked with Dr. Hemanta in Maharagama. And I have seen how this dentist work. Because you are working in a small environment without a proper AC, without the cross ventilation, without all of this ventilation, So you're getting quite a lot of splatter coming out. Assume that there is only one COVID-19 patient. He expels, the Quanta that is more than enough to make all 4 people sick once they are exposed to 15 minutes. I can show you. The modeling has shown if within that area there are 4 doctors, let's say dentists, maybe plus another 4 assistants, right? Out of 8, all 8 are going to be sick. So that is the danger. So therefore, I mean, truly speaking, when you are looking at the government places, you should have a separate, I would say, I don't know how to say, I don't know whether it is possible or not, but I do believe that you have to have a separate spaces for every chair. Or in other words, completely you have to put it into a cubicle, right? When you say cubicle, the cubicle is completely closed, right? It's not halfway partition, completely closed. So therefore, the risk could be made minimum, because otherwise what will happen if one patient comes, so he is going to give everything so that the entire group of people who are there will become sick, and then most of the time they become asymptomatic, and then they contract the disease. After 2 days of incubation period, or maybe 2 to I would say 6 days, they are going to give it to some others. So therefore very difficult for you to find it out. So then the only thing is you need to isolate the entire government building, or maybe your clinics, right? So that is where you are heading unless you do this. So therefore the risk factor is very, very high in your government places. I think you got to tackle this. You got to discuss with your authorities and make it make sure that such environment is completely eradicated.
Right. Thank you very much for enlightening us on that aspect. And there are 2 questions from the same attendee, Dr. W.A. Jayasurya. The first question is bipolar ionization unit. Is it available in Sri Lanka?
It is available. It is available. Actually, we have in University of Moratuwa, we have quite a lot of, I would say we have signed an MOU working with these private sector people to, help them to prove that whatever they bring it to Sri Lanka are, proven stuff. So we have been working, and then it is available in Sri Lanka, and I'm going to, donate one to the next week to the Maharagama Institute to Dr. Hemantha. I think if anybody wants to, have a look, can come and then have a look. So that can be fixed maybe closer to the AC, so that would, basically kill 99% of bacteria and virus, right? But if you have too many ACs, let's say 2, 3, then you have to have 2, 3 units. That is the issue. But if you have one, definitely you can be able to fix it. And then basically the major fraction of your viruses, particularly viable ones, can be completely eradicated from your environment. So that would help you a lot. It's a small gadget which can be able to fix.
Right.
That service, if anybody wants, I can be able to, provide you all, the whatever. So what they can do is I can give my number so that they can call, and then we can give you even the technical support. All we give at the University of Moratuwa free of charge. So we never charge anything, and then we basically give everything free. So if you have any issue, definitely we will help you.
Yes, Professor Mahesh, if you mind, we can even share your contact details with the attendees.
Absolutely. Yes. My number is 07773205990. You can call me. You can email me, so that definitely I will reply you. 07773205990.
I will put it in the chat.
Yes.
That people can, yes. Thank you very much for that information. And the next one from same doctor is that, is there any value of using air purifiers?
Sorry, tell me again. I couldn't understand the question well.
Is there any value of using air purifiers?
Values. I don't know how to answer that. I couldn't understand what she wants to know basically.
Okay.
Whenever you say air purifiers, you need to know how the air purification takes place, right? And I do not recommend you anything other than the bipolar for the time being, because others are not very good for humans. Say, for example, UV. UV is not good enough. Ozonation is not good enough. Even the disinfectants as well are not good enough, right? So now, say for example, some have now what you call this disinfection chambers, which is a very bad idea. You never ever have such things. Or sometimes I have seen UV, even the UV chambers or the UV bulbs are fixed inside the indoors, which you should not do, because UV radiation and ozonation both are pretty bad for the human beings, right? They're carcinogenic if the load is going to be more. So therefore, we don't recommend them. The only thing that we recommend would be bipolar ionization. You can go to internet and there are quite a lot of plenty of literature available. So therefore, you can be able to find. But UV and ozonation is fine for for an area where the human interference is less. But if you want to get rid of get rid of bacteria, now let's say your whatever the goggles use, or maybe your some of your the mask, if you want to reuse it, you can put them through ozonation unit, or maybe even the UV chamber, so that you can be able to kill them and you can use it. But people should not get themselves exposed to UV and ozonation.
Right. Okay. Thank you very much for that question. And the next one is by Dr. Shriyani Basnaika, and she's saying, thank you very much for the very informative lecture. Can we use a fan if there is natural ventilation?
Of course, yes. Very good. Because what the ventilation does, the natural ventilation does is, because it brings air, the fresh air from outside. Now, because of the fan makes that air full of the entire, full of the entire environment or indoor. So therefore, there are no dead zones. That's what the fan does. So therefore, the fresh air comes in, and the fan makes the fresh air, just travel each and every corner of your room, and from one side it will go out. So therefore, that is why I always say that you got to have what you call the cross ventilation. From one side it enters, from the other side it goes out of your room. If you have that scenario in your clinic, ideal.
Right. Thank you very much. The next question by her is, do you need to fix the bipolar unit to AC?
Say for example, if you just fix much closer to this, so that the air that is coming from the whatever the AC sweeps this bipolar unit. So therefore, you will guarantee that that air, whatever the air that comes out, usually have virus, right? And then this virus could be easily killed by these ions. If these ions are going to be somewhere else, the chances of getting all these viruses killed is less. So therefore, that's why people always fix this gadget much closer to the AC, right? Because the AC is the one which brings in, the air, cool air into your environment. But apparently what has happened is it goes back, through the filter, and then it comes, 50% of that comes back. So since you don't have the HEPA filter, that 50% has virus, right? So therefore, that is the danger of AC.
Yes, so we have a couple of questions about the N95 or the KN95 mask. One is asking, can you sterilize N95 mask and reuse them? Whereas the other is, can we reuse KN95 mask?
Yes, I mean, to be frank, you cannot reuse it, right? Because if you are going to reuse it, you are taking your own risk. Because whenever you use, again, what you have to do is you just do the thermal, treatment, or maybe you're trying to, keep it under, high temperature for some time, and then you're going to use it. there are studies done very recently. Even the last week, there was a new paper, a new paper. I saw that it was available, then I read it. And then what they do is they bring this up to a temperature of 80 centigrade and then keep it at 80 centigrade for 30 minutes. And they, prove that it can be used. But the problem for us is the material. Some of the materials are going to be worn out, because we have there is a method called FTIR method from which we can find it out. What will happen for the fibers? If the fibers are intact, absolutely no problem. So therefore, it depends on whatever you get it. But I don't think that you should, guarantee the quality of N95 nowadays. But I do believe that actually we have tested like 3M. 3M brand would be very good. I'm not promoting, but what I said is what I checked. The 3M brand, yes, if you want, you can do the thermal treatment and then you may be able to use only twice. Remember, still only twice, not over and over again. But others, I have no idea. I don't know whether the K95 can be used again after some treatment. But I do believe that you should not. Because why? Because it is you who wear this again. But you are taking a greater risk, taking it back. So therefore, the best thing is, you should, go for HEPA filter. Yes, it is a bit expensive right at the beginning. But if you just wear this over a period of time, you can guarantee that the virus won't come to you. So therefore, it's up to you.
Right. Thank you very much for that clarification. And there is another question related to that. Are there any agents to buy masks with HEPA filters?
Yes, there are. There are, but only problem is as soon as it comes, it's basically sold out in no time. Because actually we have tested this recently one set which came from USA, and immediately within 2 days the entire set goes off. Quite a lot of people buy, like professionals, they basically buy. And also that is the only solution if you have to go to the gym. Those who want to go to the gym, make sure that you need to have a HEPA filter, basically. Otherwise, the highest place where the Quanta levels are concerned is the gym. So you need to have this type of thing. So therefore, the only thing is just give me a call or maybe drop an email. So I will try to find out where they are available, and I will be able to help them find. That I can be able to do. But the problem is actually as soon as they come here, so it's very difficult to remain. Everybody wants to come and then buy.
Right. So thank you very much. And the next question is by Dr. Hemant Amarasinghe, and he's asking two questions. The first one is, how many hours need to be exposed to the sunlight or UV light to destroy the COVID-19 virus? And is it possible to destroy the virus by exposing to the sunlight?
I do say no. When you say UV, usually we say UV, the rays UVC, and then the UVC is produced. And then if you just keep it for the sunlight, you don't know whether it would be able to remove completely, because there are a lot of shaded areas, right? And whenever the viruses are in the shaded area, it will not be killed. So therefore, this UV artificially generation is fine, but the UV coming from sunlight will not help you remove completely. So therefore, my advice is, I don't think you should, just use them, with this under the sun to keep the virus, basically free. But I do believe that the UV, through the bulb, you can be able to, generate UV. That would be useful. But remember again, not for the area where the people are. That is very, very bad for the people to get exposed. But for your, whatever the, let's say equipment, whatever use, they can be, treated with UV. That's possible.
Right. Thank you. And the second question is, what is the rationale of high humidity and COVID-19 virus spread?
Yeah, this we have done in Sri Lanka. Actually, we collected almost all the data with regards to this temperature and also the humidity. I mean, to tell you the truth, there is no correlation as such. There is no correlation even for the temperature and as well as the humidity, but there is a slight association for temperature. When the temperature is high, there is a little reduction in numbers of COVID-19, and it is the other way around for the humidity. But when you look at the humidity, usually you are looking at relative humidity, but the association is not for the relative humidity, it is with the absolute humidity. So absolute humidity always differs from pressure. So absolute humidity, yes, if the humidity is less, there is a high chance of the virus be active or be basically uh, they even though they are in the dormant stage, they remain in the air for a longer period. Means usually we call it linger in the air for many hours. So therefore, the low temperature, low humidity always causes problems, right? So that's what people say. But in Sri Lanka, it has not been proven. So we don't have data to prove that.
Right. Thank you very much. And since this is a very interesting topic, a lot of questions are coming up as we are moving on. We'll try to answer many questions as much as possible. And the next one is from Dr. Prabhashini Ranavir, and she is asking how to clean the handpiece. Does it to be autoclaved after patient to patient?
Definitely, you need to do autoclaving. After patient to patient, you need to do autoclaving. Because the autoclaving would help you remove most of the bacteria, because otherwise if you're doing, if say some people would like to clean it with disinfectant, never ever do it, because disinfectant would not guarantee that all the viruses are removed, right? So therefore I do believe that the autoclaving is the best option, so you should go ahead with that.
Okay, thank you. And another question from Dr. Sundar. He's asking, what's your advice if hospital has central air conditioning?
That is actually another issue, because whenever you have a central air conditioning, nothing can be changed easily. So therefore you have to adapt yourself to whatever the AC levels that is coming out. Usually, knowing the BTU level, we can calculate the ACH. That is, we call air, the air exchange rate, or the air change per hour is what is important. If you can prove that the air change per hour is more than, I would say, 15, you are safe. If it is not so, you cannot. But truly speaking, you don't get 12, because people don't put it with very high fans. So because of that, whatever comes in is less, and also people doesn't like to have the cool air. If always you get a bit of a hot air, so because of that, it's going to be very difficult unless you have something like what I explained. The engineering type of solution has to be there on top of AC. Otherwise, nobody can be able to guarantee, because issue is HEPA filter. But I don't know whether sometimes some people nowadays have the HEPA filter fixed. If you have the HEPA filter fixed, you can be able to work under the AC. So therefore you are mainly safeguarded, because the HEPA filter does not allow viruses to come back. So therefore I cannot answer exactly without knowing whether the central AC has a HEPA filter or not, but usually not. Usually not. So if there is no HEPA filter, you will be in trouble. So you cannot be able to guarantee that the ventilation is enough. So my advice is you must then use N95, and also try to use at least some suckers. So the aerosol suckers. So therefore, at least you can make it to a certain extent safer.
Okay, thank you very much, Professor Mahesh. And another question by Dr. Shriyani Basnayaka. She is asking whether it is possible to reuse N95 mask after 4 days?
Not really. Not really. Because the issue is this. Whenever you use N95, the issue there is inner side of the mask. That is meant for you to use only for a certain period of time, and then after that it becomes wet. Once it becomes wet, particularly for N95, N95 is a very sealed one. You know, you don't get much leaks through N95. Once it is, say for example, once it is blocked, what happened? You are trying to, you know, breathe pretty fast, right? Rapid breathing is the only way for you to, you know, inhale. Otherwise, you are not in a position to inhale. So whenever you do so, inside, when you look at the nano levels, there are certain short circuiting taking place, right? So therefore, there are certain paths through which air comes without being, you know, filtering, because you are trying to, you know, exhale and inhale pretty fast, right? So therefore, the use of, or the efficiency of N95 drops. That is why it is very clearly given that N95 must be thrown out after 8 hours of use. Why N95 is mainly for you to use extended, you know, number of hours, meaning 8 hours. After that, my advice is you better not to, because we don't know the quality of the N95 or K95 coming now, because there is a shortage of production. Because of the shortage of production, so quality guarantee may not be as what we expected. So therefore, I mean, I don't think that you should take a risk of using it again and again and again.
Right. So this is going to be the last questions by the attendees. Shall we set a duct fan system for the external suction purposes?
You can. Absolutely no problem, you can. But still, again, I just want to say that it has to be, you know, checked by a technician to make sure that it has the enough exhaust power. So in other words, the velocities, because we are looking at the momentum in theoretically, or maybe in our engineering terms, we look at the whatever the advection part or the advection forces that should be able to, you know, just take everything in. Because many things that once you absorb or, you know, suck it, that is enough. No, you need to make sure that wherever the pressure develops, you have to make sure that you have a negative pressure. But sometimes you get, you know, positive pressure once it goes in, and there everything stops. So meaning that your system does not work thereafter, right? Because there are a lot of blockages that are taking place. So therefore, that has to be, I do believe somebody has to endorse it, that this system works. Then no issue, you can be able to use.
Right. Thank you very much, Professor Mahesh. And one last question from me. So
Yes.
a lot of attendees were very much interested about this bipolar ionization unit.
Yes.
So how much is it going to cost? Because you said that you are going to donate one to Maharagama, but
Yes.
I will not be very fortunate. Yes.
So one, say for example, we have different types. So the one that I'm going to give them is enough for 300 square feet, right? 300 square feet, smaller one, which is going to be like 35,000 rupees. But for, if you have to go for a bigger area, so that is up to like 1,200 square feet, it's going to cost like 150,000 rupees. 150,000 rupees. So what you do is there are certain companies who, you know, do it, and then they fix, and then they will measure the ionicity or the iron levels. So with that only you can be able to, you know, say, because there is no way that we can be able to get samples from air and made it you know, tested for COVID-19. There is no way. So therefore, what we can do right at the moment, and everybody does in the world, would be they measure the ionicity of the air. With that only you can be able to say. So therefore, that can be done.
Right. Okay. Thank you very much, Professor Mahesh Jayavira, for that excellent presentation and answering almost all the questions that we had. And I have already shared your email address as well as the contact details with the attendees. So if there are any problems, they will contact you. And I would like to say to the participants that we will be sharing the video recording of this presentation as well.
Thank
So
you.
I think that was a very fruitful webinar tonight. So thank you very much, Professor Mahesh, once again, and hope to see you all on next Sunday at the same time with our third webinar.